common assertion, health is wealth, takes its roots from the fact that it is only a healthy society that can be productive. Nigeria, with an estimated population of 2 million people, is reported to have one of the highest health needs globally. Poised to improve health delivery in the country, the administration of President Muhammadu Buhari has hinged its policies on revamping tertiary healthcare services and taking services to the grassroots for the attainment of quality healthcare. In January 2017, the federal government flagged off the primary healthcare revitalization program, targeting to have 10,000 functional primary healthcare facilities, with at least one in every political ward in the country. The project was cushioned with another launch of the Basic Healthcare Provision Fund in 2020. Under it, 1% of the federal government consolidated revenue and contributions from donor grants is set aside to fund and help revive the health sector. Same year, the federal government also rolled out the second National Strategic Health Development Plan 2, 2018 to 2022, and disbursement of funds to high-performing states under the Save 1 Million Lives program for results. The 5-year plan is aimed at achieving universal health coverage in Nigeria, where quality health care is made available through training of personnel, routine immunization, and provision of facilities and equipment. The federal government has also commenced the establishment of functional and responsive National Emergency Medical Service and ambulance system across the country. This is to ensure that emergencies are properly taken care of at no cost to the end user. The COVID-19 pandemic took the world by storm, with overbearing burden on the health sector, yet Nigeria has remained resolute, recording one of the lowest cases globally so far. Aggressive sensitization, sustained surveillance, contact tracing and tracking of infected persons, and provision of routine services, as well as prompt vaccination of the citizens are among the scorecard. While the government may say it is working to improve the health sector, and if possible, reduce medical tourism abroad, experts still advocate for more to curb brain drain, as the country is reported to have lost over 25% of its high-profile doctors to other countries. The question remains, at what level has the country achieved universal health coverage to ensure that services are readily available to its people? This and other achievements recorded by the present administration in the last 6 years is what our guests on Good Morning Nigeria will come up soon to address.
And to discuss the last 6 years of this administration with focus on the health sector, we have the Minister of Health, Dr. Osagie Ihanire. Always a pleasure to have you on Good Morning Nigeria, sir.
Thank you. My great pleasure.
You're welcome.
Thank you.
And also joining us in the studio here in Abuja is former Director General, Nigeria Center for Disease Control, and member, ministerial expert on COVID-19, Dr. Abdulsalam Nasidi. Thank you for joining us, Dr. Abdulsalam.
Thank you very much. It's my pleasure. Thank you for having me.
You're welcome.
All right, we also have with us here in the studios the Chief Executive Officer and Founder, NISA Medical Group based in Abuja, Dr. Ibrahim Wada. Dr. Wada, delighted to have you this morning.
Thank you, my pleasure.
Okay. All right, so let's begin the conversation first with the Honorable Minister of Health, Dr. Osagie Ihanire. COVID-19 somehow has become the measuring rod for the resilience and capacity of healthcare systems around the world. But of course, before COVID-19 came in 2020, there were activities and events and occurrences in Nigeria's health sector. That versus our response to COVID-19, in your view, you've been on the saddle for 6 years, what have been the milestones and what have been the challenges?
Well, there are many, many challenges in the health sector, and they're not just in the health sector, but in the country as a whole. As you know, Nigeria suffered from severe infrastructure deficit and a lot of what you need, the wherewithal you need for economic development, and also even in agriculture was all not in the best of shape. So the government had to give attention to a whole array of challenges in all sectors, and that of course meant that not every sector got all of what it wanted. Nevertheless, a lot was achieved, I would say. And as you rightly said, COVID-19 came in and put a spanner in the works, which turned out to be a challenge for every health system in the world. If you have been looking at the news, foreign news, you'll see what's happening in India. And as strong and as resilient as the health system was supposed to be, they suffered. You see the patients who have to go and look for their own oxygen cylinders to carry to a hospital or to a center for, and in other countries indeed, even in Europe, it was the same problem. So scrambling to respond to the various challenges of COVID-19 brought a lot of lessons and also showed the weaknesses globally, and provided the opportunity also to repair your health system, to strengthen it, and to modernize it. So that is what we are about.
Honorable Minister, 6 years of Buhari administration, talking about the milestones, what were the achievements? What would you tell Nigerians about the milestones in this regard? COVID-19 is a challenge, a big one, which will be really a very serious thing to discuss. But of course, Nigerians really want to hear what positives were there, in this time under review.
Well, the first thing to remember is that the health sector is multi-layered. There's a responsibility for the federal government, responsibility for state governments, and responsibility even for local governments. And we try to engage communities to also wake up and know that every community has a role to play and has a part also in strengthening the health system. So the government, of course, the federal government, of course, will generally be called to answer for the entire health sector, even though there are many players in the game. The health sector is said to be on the residual list, but it is practiced as if secondary health care with the state government, primary health care with the local government, and the tertiary and specialty health care with the federal government. But in reality, federal government has to support all these layers. And since the very foundation of the healthcare sector, the very, very foundation is primary healthcare, federal government has to put its own investment and emphasis in strengthening that foundation. And it is on that foundation that the entire health structure rests. So that is why the rejuvenation of the primary healthcare sector is being undertaken now. We are preparing for a summit in about a month and a half to again draw attention to primary health care. It is going, once you have your primary health care right, the rest will begin to fall into place.
Well, again, we keep using coronavirus as a backdrop, but even in discussing COVID-19, we hear all kinds of things to say, look, there are underlying ailments, if there are underlying conditions, and so on and so forth, which means that those underlying ailments, those underlying conditions or diseases are still with us in this country, whether communicable or non-communicable. How has the government responded to this array of diseases and the burden level in the country? Malaria being one, for instance, HIV being another.
Excellent. And that is why, again, everything begins with the primary healthcare sector, because the bulk of the population will have a primary healthcare center near enough to them, within a few kilometers or even a few 100 meters. And it is at this level that you take care of the majority, perhaps 60 to 70% of your disease burden. And that includes basic things like diarrhea, malaria, and immunization and health education. It's taken care of at that level. If you have that level working, you have solved most of your problems. And it is precisely that area that is weak in our country, because it is not a glamorous area. You don't see big buildings, and the interest seems to be in big, visible hospitals where we display gadgets that will be imported. But yeah, those ones are important, but even more important is the very base. And it is at that level you can take care of HIV, medication, diabetes, asthma, tuberculosis, malaria. They are all taken care of at that level. And even issues of nutrition. because nutrition is a problem here. There are 30% or more of children who are stunted. And so pure education of the parents and of the families will already be part of what takes care of your primary health care. So if you want a healthy population, if you want human capital, it begins with the very basics, and the basics are done at the primary health care level, and then you graduate on to the secondary health care, the general hospitals of old, as you will know. That's where you take care of more serious things like surgery, general surgery, O&G, and pediatrics, and so on. You have more specialties in that area before you get to the third tier, where you really now have a lot of research, a lot of more complex things going on. But that's the most visible, and that's where people want to immediately head to, which is not the right approach. Then the other thing is that for the secondary level, which is actually the remit of the state government, federal government has to work with them, or must work with them, to keep the structure of the system upright, because if the state governments are not putting much effort in that area, then it sort of weakens the system. So we are working to design a way to strengthen the secondary healthcare also by bringing personnel from the universities to support service delivery in that level, so that you have a more robust and a more strengthened entire system.
Oh, well, thank you so much, Honorable Minister. We shall come back to you later and then discuss much more about these issues. Let's turn to Dr. Abdulsalam Nasidi. Looking at this administration in the past 6 years, a lot has happened, a lot have been achieved, and there are so many challenges still. We're still grappling with some coronavirus, the HIV, and the rest of them. How would you assess this administration's, approach or effort in disease control in the time under review?
Well, thank you very much. I would like to start by a general statement that, a lot has been achieved, even though we could achieve more. We've done a lot, we could do more. By that saying is that, if we were to list some of the major achievements made, in the last 6 years, even though we always like to wake up in Nigeria to start looking at the negative, but we have done a lot of positives. So I think time has come to start looking at those positive things that we have done. For instance, we take the polio issue. The journey was so long, started from 1978, 1983. All through, many countries eradicated polio and 4 countries were left. That was Nigeria, Pakistan, India, and Bangladesh. And we were afraid. We never wanted Nigeria to be the last. So all efforts were made to make sure that, we were not the last. And it is under these 6 years, under this government, that now we really arrived and got polio eradicated from Nigeria, and by that doing from Africa. That's a major achievement, I believe. Then secondly is the issue of Ebola hitting us, by surprise. And I think the whole world, praised how Nigeria handled that Ebola, and that dove into the period of this government also. Even though it started, from the previous December, the system used, to fight, Nigeria used to fight that Ebola wasn't intact. And to be frank, it was the coming of this government that consolidated that tool. And that tool is the establishment of the Nigerian Center for Disease Control. We started it, about 11 years ago. It was coming very slowly. We have the act, and the act was not passed, and there's been argued at the National Assembly, going up and down between the presidency. During this regime, that act was passed and assented by the president with, phenomenal speed. And so the NCDC became the first national public health institute in Africa, which now is being emulated by many countries. And from that NCDC, from that act, all the other West African ECOWAS leaders said they must have their own distance. So countries in ECOWAS started copying us, then African region. Then now, I'm proud to announce here that it is from that point that, the African Union CDC was established. So we had that. Then the one that I will point to is the COVID response. And I think even though people think Nigeria has not done much on COVID response, we have done a lot. There are lapses. When we have time, I'll talk about that. But in the area of responding, in the history of our disease control in Nigeria, we have reduced our response time. Now, before, if there's any outbreak here and there, it will take us 3, 4, 5 weeks to mobilize and go there. But with the advent of NCDC and the silent performer, I call the minister silent performer because he doesn't talk much, but he's doing a lot underground. Is there. He empowered this NCDC, the MPSC, all the, health institutions, and we responded. We were not disgraced. Maybe people don't know, the WHO, honored Nigeria's response and termed it as, an example for other countries to copy. And Nigeria was honored in the WHO National their hall, in Geneva, that this was broadcast worldwide. But we are not selling it very well. So these are some of the achievements I can mention, at least that occurred during these 6 years.
All right, Professor Nasidi, thank you very much. Let's also bring in Dr. Ibrahim Wada. Dr. Ibrahim Wada, of course, you are in the private sector, let's have your assessment of what the health sector looks like in 6 years of the Buhari administration.
Well, thank you very much. I'm very honored to share this platform with great people like the Honorable Minister and my brother, Professor Nasidi. Nigeria is an example to the world when it came to the issue of control of COVID-19 and before then the Ebola situation. Why do I start on this note? One is to thank the people too, not just the government. The government's done great and made us an example. What about the role of the people? We are in the private sector, and I want Nigerians, both the government and the people, to be saluted for this courage and example that we've shown the world. Having said that, the private sector has witnessed significant growth in the last 6 years. There's no doubt. Government is not stopping us, and that's all that we ask for. What is the motto? 200 million people can do, and we are showing that government plus private can move Nigeria to the space where the world can look at us the way they've seen demonstration of our abilities in COVID-19 and Ebola, and even HIV, to be honest, if you remember Uganda and all that. So I'm very pleased that we are at a moment in history where the government is allowing the private sector to grow and to move without dragging them. Of course, there are issues. We've witnessed many more players come onto the fold, and it's beginning to spread to the rural areas in terms of quality medical practice, supporting the government's role, because government alone, nowhere in the world are they sufficient for the people. High specialist areas are coming on board, whether it's heart, kidney, whether it's fertility, whether it's cancer. I'm so pleased with the developments that are going on around the country, from Lagos to Kano to Abuja and even the state capitals. This is good news. A lot of them are private developments. They must be encouraged, and they are being encouraged. The other part that I want to address is the marriage between the public sector and the private sector. Again, we have a huge population. Government cannot do it alone. Private cannot do it alone. What about public-private partnership? Well, I've been in that space for the last 14 years, and I'm grateful to the Lord for that opportunity to demonstrate to the country that Nigerians can access quality health care under the PPP canopy, better priced, but even then, we expect Nigerians to go for health insurance cover. That's what saved the world. It is not what you dig into your pocket to spend as much as what the rest of the population contribute to help you when you are in need. That's the story of America. That's the story of Europe. That's even the story of the wider world that we are looking up to. So I want to encourage the Honorable Minister and the government to allow quick growth in private health insurance coverage. I see it, but it could be a bit faster. And once that is done, any sick Nigerian can wake up and say, I want to get help, and they don't have to look at what is in their pocket. The final part is the primary health care. This is the, how do you call it, the foundation of healthcare anywhere else. I look forward to progress, because I know the National Primary Healthcare Development Agency, the state ones, are doing their best. But the time for partnership with the private sector to grow and develop primary healthcare has come. If we get that right, it means every Nigerian will have a clinic address at least. Whether it's manned by a doctor or a nurse or anybody for that matter, they have a place they can wake up and say, hey, look, I'm not well, I'm going to my first port of call, even before they are referred to more advanced layers. So I want to agree with the Honorable Minister this morning that primary healthcare is the way. What I want to add is government alone has not been able to do it over the last how many years? The private sector needs to be more heavily involved, encouraged, and to be more accountable for the people's health. Thank you.
Oh, thank you so much, Dr. Wada. Let's turn to the Honorable Minister of Health, and then see what really came out of government largesse and interventions in the COVID fund or COVID-19 interventions. About 500 billion naira have been dished out for that in that intervention, order to upscale, and then see how we can improve facilities in this country. And the stories have been really positive from what we hear our guests say, and of course from what we read from the papers. Could you shed more light for us on this? And then let's see, where have the intervention been so critical, and how has it really affected the fight against COVID-19?
The peculiar thing about COVID-19, as you remember, it was called novel. Novel meant that, yes, we had an idea of the family, which is a corona family of viruses, but this particular strain was new, and the behavior was not known, and a lot of information that is now known about it was not available at the time. So sometimes it looked as if some maybe not necessarily here in Nigeria, but in other countries abroad, maybe some errors were made in what they were doing. But because we were sort of hanging behind, the infection started in China, spread to Europe. So we here in Nigeria were watching very closely what was going on, how it was developing, to learn lessons and be a little bit ahead of the outbreak. Just as we are doing now, the so-called second or third phase going on in other places, we are watching and learning lessons and trying to adjust and prepare. Now, until we began to know what was needed, it took a while before we actually realized that the target organ was actually the lungs. It wasn't very clear at the very beginning. And by the time that was discovered, they thought it was some kind of obstruction, some kind of pneumonia. And we thought oxygen concentrators would be enough, but it turned out that no, it's not that. It's ventilators, and then ventilators, no, now high flow oxygen is what we need. That's why we're now building oxygen plants. The government has approved 38 new oxygen plants, and we have been able to work with our partners to have an additional 30 old ones to be repaired and brought back into life. And then in addition to that, another 12 again. So we're going to have a real oxygen saturation of the country that will be able to take care of a lot of deficits that existed even before now. So you can take care of the pneumonias, the asthmas, and all the problems we had. And we want to make sure that no hospital needs to go more than 100 or so kilometers to get their own cylinders. We're also placing an order for oxygen cylinders. These are special cylinders because they are seamlessly made and of different sizes, including those that you can carry in an ambulance, so that you can use all of that to a better clinical response. But the same thing happened even with the medication. It was all experimental. At first, they said it was chloroquine, then hydroxychloroquine, and then remdesivir, and then the Madagascar herbs. So it went this way and that way until we just settling down on steroids and high flow oxygen primarily. So the growth, the addition, value addition for the health system is going to be a wider availability of oxygen all over the country for various purposes, whether you are doing operations, whether you are treating any kind of problem that requires oxygen, you will now have it. Then there's also the large number of ICUs that have been built. Government has built many ICUs in every teaching hospital. Isolation centers have been built, and a lot of knowledge, a lot of training has been done, which has increased the capacity of those who will respond to public health disease emergencies. And remember, one of the first hospitals to come to our aid was Irua, which specializes in viral diseases, and they helped to stabilize the anxiety here. They have also learned a lot. They have been carrying out research, and other state institutions have learned, particularly Lagos. They have been able to learn a lot about responding to disease generally. So we're in a much better place. The investment that has come into the health sector in that area is tangible. You can see it. You can see the improvement it is going to give now to protect the country, and even after post-COVID, you are going to see the entire benefit for the system, which can be something that you can retain and work with in that and other respects.
Okay, Honorable Minister, and the other two specialists who are also medical professionals, Professor Nasidi and Dr. Wada Ibrahim. When COVID broke elsewhere in the world, and we were hearing about the numbers as they were escalating, there were dire prognoses, that's to say forecasts, as to what was going to happen to us on account of our fragile healthcare infrastructure and systems. But we have seen, amazingly, the numbers, whether in terms of the rate of infection, number of infection, or fatalities. I want you to just tell us, this is by way of management now, so that persons can get to understand the style of governance that has produced these results that we are seeing. What kind of anxieties did you have, or did the Buhari administration have, about coronavirus making a landfall in Nigeria, and with the threat that it was going to wipe out the populations? Because a number of persons who have Plan B and also a Plan C took their passports and went to other, presumably safer locations. So how did you confront this epidemic and brought about some of the very positive outcomes that we have seen?
Well, in the first place, I would like to advise that we are not out of the woods. Other countries who thought they were out of the woods have found themselves struggling with another wave. So I do not like us to drop our guard, to be complacent and to be confident, because what we see in other countries, we learn from. And that's why we are increasing our oxygen availability, because we see what happened in India and other countries. Even in the UK, we are short of oxygen, even in the United States. So most health systems were taken by surprise. COVID turned out not to be a respecter of any health system, and just as it was not a respecter of borders, until we began to know little by little what we need to get to react to it. But generally, we had, in Nigeria, had the advantage of being able to observe very closely what was going on, and driven by a little bit of concern about our fragile health system and then the magnitude of this disease. And as the parable says, if you are not strong, you better be fast. So we try to be fast in how to prepare ourselves. We were among the first in the world to start carrying out stringent border controls for travelers and taking travel history at a time when others were not yet doing that, and watching for movement. And we worked, and I will say here, we worked very closely with Nigerian embassy in China. They helped us a lot to keep an eye on movement of persons coming into our country. And at that time, the Chinese population had gone home for their New Year, and there was a lot of anxiety of what they would bring when they came back. But we had that surveillance that was matching virtually everybody coming from that area, including Nigerians. And there was a time we got information that a Nigerian had left Wuhan, the very center, and had come into the country. And well, it was unknown to many, but we immediately went about tracking this man, immediately tracked him down. And with the help of Lagos was very good. Lagos is very well organized. And so we had meetings all the time, myself, NCDC and Lagos Commissioner, a lot of meetings. And we tracked down this gentleman. Although he had somehow slipped through immigration, he didn't fill his travel form. And we put him under observation. And after the period, we found that he was not infected. But that is the level of speed and care that we took. By the time the first case came in from Italy, we screened 69 people who had contact with him. He was immediately quickly diagnosed. We gave a lot of kudos to the young doctor who thought of COVID when she first saw him, because others would have thought of malaria or something else. And he turned out to be positive, tracked 69 persons, and one was also positive. So those were our first two cases. And we were able to treat those two. And that would have been the end of COVID if not that other imports started to come in. It was virtually not possible to stop it at that time. This is a disease that went around the world in record time. No other disease has gone around the world at such a speed and affected virtually nearly every country in the whole world.
Oh, well, thank you, Honorable Minister. Professor Nasidi, let's get back to your discussion earlier on, your conversation, talking about disease control and how the NCDC in Nigeria become the pest setter in Africa and being emulated all over. And of course, you mentioned that World Health Organization, honored Nigeria for its response to COVID-19. Now, let's look at the aspects of responses to diseases in this country. Polio, you've mentioned how we were able to get out of that. And of course, Ebola was there, and malaria is still hanging around, and so many other ones that they still need, attention. Nigeria Center for Disease Control has been up and doing, at least to a certain level in this regard. What are the other things required in order to see to it that it becomes a world-class disease control center?
Well, thank you very much. The key is, as the Honorable Minister has mentioned, when we have these challenges, especially the COVID challenge, and the health system was overwhelmed. And many stronger countries, who have stronger health systems, their system collapsed under the feet of COVID. You can see Brazil, you can see India that was very strong. They have even the largest manufacturer of vaccines, in the world. It's existing in India and all this. But when the real terrible second wave hit India, we also what is happening, the health system nearly collapsed, and the largest manufacturer of the vaccine cannot even produce enough vaccine now for its own people, not to talk of, to export. So, but then, unlike some of these other countries like the US and Britain and also where we say COVID was raging and really devastating their system, while we're having COVID, coming in and just about to spread and kill our people, we were also having threats from other diseases. Nigerian Center for Disease Control, Federal Ministry of Health, was battling Lassa, concurrent Lassa outbreak. They were battling some cholera here and there and so on and so forth. Measles was coming. So we had multiple problems, public health problems on our hands. And it was a miracle that while we were fighting the COVID, we were still struggling to minimize or mitigate the impact of these other diseases on our population. So, but there's one other area that will have, made that forecasting that you said, where they say, oh, this disease will kill Africans, many Africans will be down the street. They thought because we had other underlying diseases like HIV/AIDS and this malaria that reduces our immunity, and that when this virus comes, it will just knock us off like this. But by God's grace, again, during these 6 years, we conducted the national HIV/AIDS survey, to see where are we really with the HIV/AIDS. What percentage of Nigerians are really infected and their immunity could have been down. And we were shocked, that that survey revealed that we have achieved a lot in the last 6 years, and that we thought the prevalence of HIV/AIDS in Nigeria was about 3.2, 3.5. But that survey that involved US CDC, UK Public Health Institute, all of them were involved. So it was well, really carried, well performed. And the rate of HIV/AIDS incidence in Nigeria was below 1.5%. That was a shocker. That's an achievement. So we have really done a lot in that. So we shouldn't occupy ourselves with this threat of COVID, and then we forget about those other ones. So along that HIV/AIDS, we have done something. In malaria, as Dr. Oda mentioned, the coming together of the private sector, particularly the Dangote Foundation, other foundations, Melu, whatever, they have come together with government to see that malaria is eradicated. But some of the areas where we believe that it's dragging us and we are not achieving what we are supposed to have achieved, I will mention maybe in the second part of the interview. And then the question you asked, what should make NCDC a role model, a real international center? Everything depends a lot on funding, appropriate funding. We are lucky that the Nigerian government has approved the basic health provision funds, and we believe a chunk of that money should be really allocated to NCDC to start emphasizing preventive medicine, prevention, to preempt. We shouldn't wait for it to happen before we start crying. If that is done, I can assure you NCDC will outshine so many. Then secondly, Honorable Minister mentioned of training. Let me just tell you, before the advent of NCDC, some states in Nigeria did not have even one person with masters in public health. Public health was so weak in the country. The NCDC, when we were establishing it, we brought a component called the National Field Epidemiological and Laboratory Training Program to empower Nigeria to be able to fight and get the right people to do the job. So you can have the best program, but if you don't have the manpower to do it, it's a joke. Within 5 years, 6 years of existence of NCDC and that NFLTEP, we raised the number of public health experts with MPH, Masters in Public Health in Nigeria, to more than 250. Now we are hitting almost 300 or 400. So it was miraculous. Again, African countries, how did you do it? So we just said, funding, manpower, development, and freedom to operate, and at the same time, international partnership. So we believe with this, the Honorable Minister, is in the lead to say, okay, now COVID has taught us a lesson. Initially, NCDC was to be ignored in that basic health program, but now that they have seen what COVID or one disease can do, I think this is the time to really refocus and empower that center to have sufficient funds to start being ahead of these viruses. And that's the way I think it should go.
All right. Thank you very much, Professor Nasidi. Once again, Dr. Ibrahim Wada, what is your assessment of maternal and child health care in the country? Is it declining? Is it stable or improving?
In just few words, I can say it's improving. The good thing about Nigeria is it's not going down in any index, in any index health-wise. However, the journey ahead is still tortuous and difficult. Nothing has gone wrong in the last 6 years in terms of maternal and child health beyond prediction. The flight is climbing. What can be done? Because that's probably the best part of the answer. Again, the kind of words I hear from the Honorable Minister and my brother, Professor Nasidi, encourage me that we have master strategists. We have huge populations, so such strategies may not get results overnight. So I want to appreciate the Honorable Minister and the NCDC and the founders of NCDC. We are lucky that as Nigerians, we don't have issues with human beings. We are blessed. What can be done in terms of maternal improvement? The reaching out to where our babies are born is number one. In what institution are they being born? Some are being still born under the traditional midwife situation. So, and I know there's this midwife program, that's like the NYSC program. I want to encourage it. It's a step forward. I also want to encourage improvement in primary health care, because that's where problems of maternal and child health are first detected, to know whether they need to be escalated to another level. So I don't want to say too much about it, but yes, maternal mortality rate, morbidity rate, indices of care are on the improvement level, or slide, if you like. They're not going down, but they're going up, but they could be powered faster. I'm here to talk in terms of my experience also in the private sector. Again, we cannot ignore the roles of the small clinics in the villages, small hospitals in urban and semi-urban areas. The word to use is that whether it's private or public, these are Nigerian resources, human, material, institutional. And the wisdom and the strategy is how to pull them together for one purpose. Let it not be that there's a dichotomy between what is, oh, that's private. No, it can save a life, so it's Nigerian. I want to stop at that for now.
Okay, many thanks, Dr. Oda. Let's hear from the Honorable Minister now. Let's get back to the issue of figures once again. Let's look at the $100 billion, dished out by the, CBN, and of course, what the situation has been. It was meant to rather sort of support, pharmaceuticals and stores in Nigeria, and see how we'll be able to have, support for these local, pharmaceuticals to see and produce as much as we can, and then get themselves so fortified and strengthened and become, maybe reach the world-class status if possible. What's the situation with this support given to local pharmaceutical companies and other health-related stores to meet up really with the, health-related, with the demand for medical facilities and services in this period, and that review especially during this COVID period?
Well, first I will pay tribute to what we call the CACOVID, as the Coalition Against COVID-19, of which the private sector is very well represented. This day, Dangote and BUA and Access Bank and many others, and of course the Central Bank, who have whose support has been totally invaluable. It can't quantify it. It's really brought a lot of support and resources into this response, and we must mention that that partnership. We hope that it's a partnership that in any crisis situation you can always fall back on. But part of the benefits that will come out of this is the need to develop our system. If there is one of the major lessons that we can learn from this COVID-19 pandemic, is that at the end of the day, we as a country, we are on our own. The capacity, the ability, freedom to travel out and go for medical treatment elsewhere was curtailed. You couldn't really travel out of the country. There was a lockdown in all countries. They were not even going to issue any visa. They were not going to let you into their country. So it became clear to those who didn't appreciate it before that we need to develop our own systems as much as we can. I will support, we appreciate the Central Bank for all the initiatives they've made. Now, the problem again falls back on demand. If you have pharmaceuticals and you are importing, then what you are importing is competing with what you are producing locally. So the issue has always been there at the background. From countries who sell pharmaceuticals cheap and try and push them into your country either legally or through smuggling. But the new approach to basic health care, and that's where the Basic Healthcare Provision Fund comes in very useful, because it is going to be catalytic. But even that Basic Healthcare Provision Fund is not enough to take care of the needs, because there's a lot of deficit. We mentioned just now about the non-communicable diseases, the maternal mortality. Where are all these happening? They're happening mostly in the rural areas. There are we lose 39,000 people every year in accidents, about 50,000 women every year in childbirth-related situations, up to 400,000 children under 5 years old every year. If you add all of that together, it's going to 1 million. And at least half of them can be saved if you had availability. That's availability of a hospital or primary health care. Access is physical access. How do you get there? How does a woman who delivered at 1 a.m. in a rural area and she's bleeding heavily, how does she get to a hospital? There's no transport. We have no mechanism for that at all. It doesn't exist. So you're on your own in that respect. And then if you do get to a hospital, how do you pay? They have no money. So that is where the basic healthcare provision comes in. And first of all, I have paid tribute to those who thought about keeping 5% for basic health, for emergencies. And then the president also who started implementing it. And that is what can bring down maternal mortality, infant mortality, under 5 mortality, and also reduce deaths from needless causes. If somebody had an accident and were picked up on the way, he might be very wealthy, but he got to hospital, there was no money to pay for a deposit, he could lose his life. So we need to create a modern system that allows us to benefit. And part of the new package coming up now with the primary health care, which we are proposing, is a bigger package of care that allows people to enroll at a small rate and raise a pool of funds that is going to augment the Basic Healthcare Provision Fund. The Basic Healthcare Provision Fund can now be used for the poor and vulnerable, and then others can pay a small amount, like 1,000 a month or 15,000, up to 15,000 a year. And if you have a good pool, and that is proposal in a new health insurance bill, you have a pool that is good enough to offer something better in healthcare to those who enroll. You get, if you are diagnosed with diabetes, you are treated, you are giving medicine, or hypertension, you are giving medicine. And all of this now, we have to be on contract to the pharmaceutical industry. So the pharmaceutical industry will now have access to supply the primary healthcare sector and be able to provide routine drugs, painkillers, medicines for diabetes, hypertension, backache, and so on, and colds, and all those basic things that will energize them. And so this value of money that central bank put down can now help the pharmaceuticals to take off. Even in the area of producing vaccines, government is working on that. This government is working on joining those who produce vaccines, human vaccines, not only on routine vaccines and also COVID-19 vaccines. So there are a lot of initiatives that will be helped first by the demand, that somebody is there to take it, and then the supply, that somebody is there to make it locally.
I was just wondering, Honorable Minister, there are a number of issues that you have raised, and indeed the other guests, but we can just label one of these aspects now as affordable health care. And we know that it's been a major challenge. Dr. Ibrahim Wada says, look, the private sector has played a tremendous role as partners, but we do know that affordability is often a challenge in accessing quality health care from the private sector. And they're available now, of course, in specialized fields. There was always an issue with the National Health Insurance Scheme. Apparently it's been resolved now, but I don't know much about the resolution of the bottlenecks that subscribers to the health insurance scheme normally will go through. And now you're talking about the Basic Healthcare Provision Fund. What is the linkage between the health insurance scheme, the National Health Insurance Scheme, and the Basic Healthcare Provision Fund, and the fact of a Nigerian being able to afford health care at certain levels, you know?
Yeah, the National Health Insurance Scheme is receiving more attention now from government, and there is a bill to make health insurance mandatory so that every Nigerian will pay a small amount, tiny amount that's affordable. And because of our population, it comes to quite a lot of money. And then the Basic Healthcare Provision Fund is also structured, of course, into what goes to primary health care, what goes into paying for service, and what goes into emergencies. But if you put all of that together, you have a pool that will help you to give service to those who have no money, and for those who have some money, who have a job, who are paying a little amount every year to access a wide range of services that they would not have been able to access before. Out-of-pocket expenditure now is over 70%. But you can reduce it to 30% or even less once this scheme is functioning. So the health insurance is there to, if it's mandatory, get people enrolled and make small contributions, particularly those who are in employment, and even those who are self-employed can pay. It's not a big amount, but once you know that the day your wife goes to have cesarean section, you don't need to pay anything, then the 15,000 you're paying every year becomes worth it. And then if you know that you are diagnosed with hypertension and you'll be given medicines free, you don't have to go and buy because it's provided by the hospital, then it becomes worth it. So that's the system that's coming up. There's a system called the Group and Individual and Family Health Insurance Project, which which the health insurance is launching once the bill is assented to and becomes an act, that gives you the possibility of also enrolling your whole family. It gives the possibility to any person who wants to enroll his own village. So individuals don't keep coming to you, giving money for, and still giving money for that. So if you enroll your whole village or a part of your village, then they all get a card.
Project.
Yes, so you get a card with which you can go to the hospital when you are sick. So that's the ideal we are going to. That is real universal health coverage.
And that's where we're heading to.
That's where we want to head to, yes. But we need the support of everybody for that, because it's not everything that government alone is going to bring up. We are going to have contributions, small contributions and large contributions. Now, if you are looking for more luxury, let's say, for example, the private ward, you can also have additional insurance to the basic health care. Now, for the vulnerable, and there is a social register of vulnerable, now the basic health care provision will pay for those ones. So for those who have a small job or self-employed, they will pay for themselves. So in that way, you increase the fiscal space for health care.
Well, that's a good news, really. But finally, on this issue, at what stage are we?
Well, the bill has been sent to the, for the National Health Insurance Scheme, has been sent to the presidency. The presidency is deliberating on it and looking at all the T's and I's and so on. And once that comes out and is gazetted, then, of course, it's ready to be implemented. But it's something that has to work with the state government also, again, because the health sector is layered. And we have to have, if you have a national health insurance scheme, you also have a state health insurance scheme. And even the community contributory scheme, which augments your primary health. So if you have a primary health care center, there's a community contributory scheme that will add little bits of money to the pool. And in return, they get governance rights of being able to have a say in what goes on in there. And then they can also improve their own community-owned primary health care center. So we are looking at being able to make it available and improve ownership at the root, at the grassroots. All of this takes time, and it takes good collaboration between federal, state, local government, and communities to realize.
Indeed, the federal government is doing a lot in that, and of course, some states are still lagging behind. Talk less of the communities where these things need to go down to, but at least we've started, we're moving. You're watching Good Morning Nigeria. We shall now take you.
It's still Good Morning Nigeria. We're live on NTA's network service. We still have our three guests with us in the studios. Dr. Osagie Hanire, the Honorable Minister of Health, Dr. Ibrahim Wada, who is CEO of NISA Medical Group here in Abuja, as well as Professor Abdulsalami Nasi, the former Director General of the Center for Disease Control. Professor Nasi, there's an aspect that I would like you to speak to. Are we awakening now to the necessity for Nigeria's medicine security, incorporating not just pharmaceuticals, but also vaccines?
Well, thank you for bringing that very important issue out. And that's why I was saying that at the beginning of my presentation, I said, when you ask, have you achieved it? We've achieved a lot, we've done a lot, but we could achieve more. And one of the major weaknesses of the current government, which we have to say as Nigerians, is they are too slow in getting some of the projects implemented. It's not enough to say you have given so much, you have done so much, and all this thing, and you don't see to it that it is really done. So these are some of the challenges that we have to bring out. Not that we're praising the government alone and all this, but there are so many lapses that they need to, step backwards and look into. For instance, we are now saying that we are having more and more threats. As we are talking now, more and more variants are being, detected. In fact, the latest one is in Vietnam, where they found that, it's as if somebody sat down there and mixed all the genes of the previous variants and put them in one. And that can be a bomb. That can be really dangerous. In Vietnam, that saw less than 50 cases, is now seeing triple, quadruple cases. So, whereas the Honorable Minister said we are not yet out of the woods. Okay, if you are not yet out of the woods, what do we do to make sure that we don't fall and repeat the experiences of others? Because Albert Einstein said only fools learn from their own experience. We are now, God has given us a lot of window of opportunity. So the prediction is not correct or it's not yet seen. People are not dying in Africa. Why are people not dying in Africa? What do we need to do to make sure that it doesn't happen, that forecasting does not really happen? One is what you said, drug and vaccine safety, vaccine sufficiency. As you've had, we have only vaccine for 2 million people. And the country is 200 million people, so it's like a drop in an ocean. We have tried, but we are not even sure when is the next doses or batches of vaccines are coming. So we really need to wake up and act faster. The government cannot wait and say, well, maybe it will come, something has to be done. Wherever the vaccine is, we must go and get. The second one is the issue of vaccine production. For the first time in history, this government allocated money, that, hey, listen, it's like advanced procurement. Like USA, when the COVID came, when they had that there could be a vaccine, US government, Trump and others, immediately he gave $2 billion to Pfizer, $2 billion to BioNTech, Moderna, and all others who are giving money, like advanced procurement. Quickly, we want this vaccine. When it's ready, you give us, we have the right of first choice to own that vaccine. Nigeria, we have so many talented people in this country. We've already gone far in vaccine production, biological production. I think this is the time, to do even more. The federal government allocated 10 billion, to facilitate vaccine manufacturing and all this. It's dragging, it's taking place, but COVID is there, the threat. But there are other areas. Now, India has about 7 vaccine manufacturers. Take, for instance, there are other products and medicines that Nigerians have developed that are working. For instance, me sitting here with my colleagues in UK and other places, we've developed an anti-snake venom. Before, there are areas in Nigeria where if snakes prevent people from farming, and because during planting season, snakes bite. During the dry season, they all come out of their house and enter people's homes. They kill people. That time, deaths from snake bites is up almost 40% in areas like Kaltungo, Zamko, even up to Shaki, western Nigeria, Nsukka, northern Nsukka. But we sat down, picked these snakes, got the antivenom, and the antivenom is working. So now we have reduced case fatality rate from about 40% from snake bites in these areas to less than 0.5%. So they are no longer afraid of the snakes. That's a great achievement. It's aiding farming, it's aiding herding and etc. So I believe this is the time. There are others who develop drugs against malaria, very effective drugs, some against diabetes. So I think we shouldn't ignore those local possibilities that, okay, we're giving 10 billion to vaccine manufacturing. What is happening? Up till now, what is on ground? Has it really been actualized, or we are still doing oversight or overlook or whatever it is, and so on and so forth? Then finally, is just to say that, when it comes to supervision, a lot of the parastatals, the agencies that are doing these jobs, seems as if they are acting alone. The Minister of Health alone can't over-supervise them. There has to be a mechanism, either a board or a supervisory group like experts in this to oversee them, to assist them to get this done. And they should be reporting to the government, not on a monthly basis. We're in an emergency situation. So these 3 things, I believe, are things that we need to do quick for the government to be able to achieve more. So these are the things I wanted to say.
Dr. Nasidi, before we let you go, let's look at this malaria of a thing. Malaria is really a very troublesome disease which has been around for quite some time. And the diseases have come and gone. They had vaccines and the rest of them have been cured, and then they've been given a sort of support that really now make people fearless about them, especially like the snake bites and things like that. What's the situation about malaria? Recently, there was this report that a breakthrough was made in that area, and we don't know how far it's gone, but we really want to hear much about that, because that is where the ordinary citizen suffers. That is why the ordinary Nigerian feels the pain.
Yeah, as you already said, we shouldn't look those diseases, because they are the silent killers. And malaria being what it is, you ignore it at your own peril. It will definitely turn back to this. But one of the worst things that malaria is doing to Africa so far now is killing the children. And all the other methods that are being used, ITN, ETC, were effective, but not as effective as we would have loved them to be. And of course, there's a program, eradication of malaria by the year 2050 or something, and so on and so forth. So in that coalition, everybody's there. The private, the government, the partners, the WHO, etc. So, but one of the key that they've seen that if we could do, that can finally eliminate the disease is one, create genetically modified vectors, the mosquitoes, etc., and spread them along the areas where these other known vectors are spreading the disease. And then, if you do that, they are doing the experiments seriously now in Brazil, and the result is phenomenal. Okay. Yeah, it's displacing the malaria spreading mosquitoes, etc. But the most effective one will have been development of a vaccine. If you have the right vaccine that can produce neutralizing antibodies, because, so like HIV/AIDS produces antibody, the virus. But that antibody it produces doesn't neutralize the disease. It doesn't neutralize the virus. The same thing they're seeing that so far, most of the vaccines that have been produced and all the other trials are actually, not producing enough antibody, neutralizing antibody to control the disease. But lately, some new developments in research, even coming from this COVID, they found out that they could do a vaccine that can, stimulate antibody production to, reduce, minimize the impact of the malaria parasite on the body. So this is the area that I think people are funding now, are concentrating more. The drugs, get the effective ones, the vector approach, and then, finally, this vaccine. Some are already in trial. If we are lucky, malaria will be history.
All right, Professor Nasidi, thank you very much. Dr. Ibrahim Wada, one of the adverts that I found personally depressing while we were still battling with the pandemic at the height of it last year had to do with the solicitation of healthcare professionals to go over to Europe on the basis of very generous visa application offers and other mouth-watering bonuses that they would receive. I thought that that was going to exacerbate the brain drain that we've always complained about in the healthcare sector. I mean, we are lucky to still have top professionals like your good self and Professor Nasidi still in the country. But are we doing enough to stem the tide of the brain drain of our healthcare professionals?
Well, once again, thank you. This is a very, very nice question. Our country is bedeviled by that. We need more doctors, we need more nurses, more than ever before. Unfortunately, the traffic out of the country is becoming uncontrollable. Let me give you personal experiences. In the last 6 months, no fewer than 30 doctors have left our organization for so-called greener pastures. This cannot be allowed to go uncontrolled, because a time will come when the effect will be very, very obvious. So why are they leaving? Well, it's again down to master plan, and I just called the Honorable Minister Nasidi master strategist. There is a way that we can stem it. They are leaving because the opportunities for more professional development, that is specialist training, are far fewer than the numbers that are wanting to become trained as specialists, because the world knowledge scale is getting higher every time. You cannot just stop at one level. You want to improve yourself and be more useful to humanity. That's number one. The second one, as far as I know, is the economic conditions, that the doctor's future doesn't look guaranteed in terms of independence. Where's your house? Where's your, how are you going to look after your kids? where are you going to stay? What about your safety and security? All of this boil to the push. And the good thing about human beings is once there's instability, people must flow. So, but all is not lost. I still have faith that when the payers are developed, what does that mean? You mustn't pay out of your pocket. What does that mean? There must be some good health insurance. What does that mean? There must be some good pooling of funds that can trap people here to educate them, to improve their quality of life. I don't want to say that doctors have given a lot in medical school in terms of, effort and years of training. And when they come out, there's a natural expectation of a better life. Nobody can give a better life than this country. It's just adjusting ourselves to accommodate it. You see, I woke up this morning and said, how many Nigerians have telephone, mobile lines here, for example? Let's even say 150 million. Each one is maintained at 1,500 just before you make your call, that kind of thing. How much money is that? What is the relativity of our health status and quality to telecommunication, pleasure, or leisure? Health is far, far, far above in consideration. None of you knows except when you are threatened by illness or you are at the point of death, then you say, oh, life is so flimsy, it's so short, but you're living. I want us, with the master strategies that God has given us, to put our heads together and say, what's our number one priority? Be alive first. The people that care for you must be looked after first. They shouldn't be by the way. Or the people in a modern economy where we expect, oh, you are a doctor, you must give to society. If the general atmosphere is not like that, we cannot deceive ourselves. So we sit down, as the Honorable Minister is doing, with the body of the doctors, whether it's the residents or the consultants, what does it take to stay? Because once you've trained a doctor, the economic value, the world is showing us. America is snatching them, Arabia, everywhere. That means of economic value. When you invest in those people, they're going to get more out of those human beings than whatever they're going to pay them. So in Nigeria, with our population, we can. Let nobody say we must keep our doctors down to, quote, help us. Yes, they are to help. It's a humanitarian profession, but it has a bottom line. It has a foundation. Let us learn from the example of the countries that are attracting us out, and we shall then position ourselves for nationals of other countries to come to our country to receive treatment and invest in us. I think the point is well made at that. We can keep our persons here. Interview them, go abroad now, and say, would you like to come to Nigeria? The answer would be yes. They might put a small caveat, but, for this. But there is no Nigerian I know, because as you may probably know, I worked abroad for a number of years before I came home. There is no Nigerian I know who can say, rubbish, I don't want to go and help my people. They all want to. What does it take to bring them in? What does it take to keep the people that are in? I've said some of them.
So this
and
is
we
a policy.
can.
This is a key policy issue.
I think the Honourable Minister really
should
respond to this and then see. Do you want to come back to Nigeria? Yes, but there's a caveat. And the other one is, do you want to get out of Nigeria?
I trained abroad and I came back.
So you know it.
Yes,
but
that was during your time. The hemorrhage we face now, including the example that Dr. Wada just gave, losing 30 of his personnel, and then it's a daily thing. I mean, you see this. Absolutely. Yes.
There is a matter of economics in it. To train a doctor in the United States is cost you about $300,000. In the UK, it probably take you to around 50,000. How much does it take to train a doctor in Nigeria? Perhaps a few thousand naira, because it's heavily subsidized. So if the UK, in all societies, every country has issues with whether you want to work in the rural area or you want to work in the city. Even in the US and the UK, they have issues with finding enough doctors in rural areas. People want to go to a rural area. And because you have gaps around there, they are always looking for doctors from other places who have been trained at no cost. So somebody who has been trained at a very affordable rate in another country, you just bring him in. So there's economics in there. The same thing in Saudi Arabia, that people will go in there, and then once you come in, giving some orientation, giving a few exams, And then you go to some rural areas where there are gaps. So once there is saturation of all those areas, they will not take you anymore. Okay, but not that we are waiting for that to happen. But the point is that there is economics in there, in that you have trained virtually almost free of charge here, because if compared to Europe, it's a lot. In the UK, if you have been trained at that expense, you pay back the money of your training. Here, your training is like a gift to you. And some people have a responsibility to say, well, if I didn't have this support, I would not have been able to afford this education I have. So I will give back. So that's a problem here with the economics, which we really can't solve. But you must also realize that the hemorrhage we are talking about now is selective, in that the countries who are picking doctors now are picking doctors from English-speaking. They will not go to Ivory Coast or all those, because those ones is difficult fitting with practice over there in their own country. Okay, so those who get it will be Indian doctors used to move in waves to America and UK. But right now their system is improving in such a way that they're able to be happier in their own area. What I think we need to do here is to provide doctors the opportunities to also, I mean, not say do for me, opportunity to do for yourself. If we have a situation where performance-based remuneration takes place, that, for example, you are paid according to the number of patients you see, according to the number of operations you do, according to how many kind of interventions you are, then every doctor will know that you can work for yourself. But if you have blanket salaries everywhere, whether you come to work or not, everybody's getting the same thing, and that amount is small, then you are looking for places where things are better. And as far as those who are willing to take you, you go there. And the other thing we need to do is also remember that there are some Nigerians who train outside the country and want to come back. There are many. And we did not make things difficult for them. Sometimes we make things also difficult for those, or for some strange reason, in sort of like saying being territorial. So we have to let those ones come in and integrate into the system. We have quite a few coming in from abroad. And some of them do have issues with settling in here. So there is this angle that we need to interrogate about the economics of it all. And that is not just for the Ministry of Health. It is for the entire system to interrogate.
Professor Nasidi.
Or briefly, rather.
Briefly, exactly as we said, it is absolutely true. It's, how do you, entice and make people happy, to really do their job and serve their nation. There's nobody that will not like to wake up and say, I must contribute to the progress of my nation, and so on and so forth. All of us trained abroad or even trained here, and so on. So this brain drain is a huge problem that many countries, not only Nigeria, is facing. And the Nigerian one is, worsened by the economic situation and others. But I'm very proud to see that most of the Nigerians that have even gone, a lot of them are looking for opportunity, to come back. And the moment we address issues of economy, security, and empowerment, you'll be shocked.
Oh, well, thank you so very much, Professor Abdul Salam Nasidi. Abdul Salam Nasidi is former Director General, Nigeria Center for Disease Control, and member ministerial expert on COVID-19. Well, thank you so much for appearing.
Thank you very much. Thank you for having me.
Dr. Ibrahim Oda, Executive Officer and Founder, Initial Medical Group. It's our pleasure being with us this morning. Thank you so much.
Thank you.
And a very big thank you to the Honorable Minister of Health, Dr. Osage Henry, for being part of the discussion this morning.
Thank you. Thank you.
And a very big thank you, too, for you out there for coming along all this while. It's been a pleasure to have you. Hope you are going to come along with us tomorrow for good